it's actually no news that the Association of Resident Doctors, Taraba State chapter, recommends and strike action, which was initially suspended sometime in September, and we had to recommence the strike action because the agreement that was signed was not honored or has not been honored. Most of the items on it has not actually been honored by the state government. You also know that currently in Nigeria, there's a lot of outcry, especially due to the migration of medical health personnel out of the country to other climes. And this is simply not, and Taraba State is actually not left out of this. Based on the population of Taraba State, it was based on the 2006 census. The population of Taraba State is put at 2.2 million, but it's also projected that by 2016, this particular population is supposed to have increased to about about more than 3 million. And so far, you know that we are currently in 2020. Based on the WHO standard, that's World Health Organization standard, based on the number of a doctor to patients, it is one doctor is supposed to be to 600 patients. But in Nigeria currently, I'm talking about Nigeria situation, the ratio is one doctor to 6,400. And you agree with me that that is grossly inadequate. Now, coming down to Taraba, our claims, what we have is one doctor to about 33,000 patients based on our projected population. You agree that this is grossly inadequate. And how did you arrive at this? It's simply because currently what we have in Taraba State, the number of doctors who are in Taraba State are actually less than 90. All the doctors in Taraba State Specialist Hospital, all the doctors at ministry, those who are actually admin, who major work are actually administrative, and those doctors who are also working at general hospitals and first referral hospitals. So some of these, out of these 90 doctors, some of them cannot, some of them don't even consult patients. So most of the people they will not attend to them because they are admin and staffs. Also in the states, we have the Taraba State Specialist Hospital, like is a specialist hospital. It's supposed to be the specialist level of care, and just created about 13 years ago. And you agree with me that any child of 13 years is supposed to have understood a whole lot of things. But currently at the Taraba State Specialist Hospital, what we have is we just have 19 permanent doctors, which is grossly inadequate. Also, doctors who are actually on contracts. We have about 18 doctors on contracts, popularly called locum doctors. You could actually see that the number of those doctors who are on contract basis and those who are permanent doctors is almost the same. And you cannot build a system, or you cannot run a viable system with this kind of arrangement. And so currently at Taraba State Specialist Hospital, there's no internship training for medical interns, both nurses, med lab. But its counterpart in other states, even our neighboring Yola, the specialist hospital, people, newly graduated doctors usually go there for them to be trained, and even the nurses. But in Taraba State, we are actually not doing that. You also know that currently at the moment there's the issue of COVID-19 pandemic, and already there's already talk about the second wave. It is worthy of note that when the COVID-19, the issue of COVID-19, even when it came to Taraba State, so far, Taraba State has not actually recorded any mortality, and it's simply because of the resilience of the health workers within the state, the doctors, nurses, and other health workers that have actually worked tirelessly for them to actually ensure that the people within the state are actually kept, safe. But it is also worthy of note that based on the agreement that we had with Taraba State government, for them to pay COVID-19 inducement allowance for healthcare workers within the state has not been done. So far, no medical health worker within the state have actually been paid. And you could actually see that already there's a talk about the second wave. So majority of the healthcare workers, doctors, nurses, pharmacists, medical lab, and even the other support workers within the health sector are actually have been risking their life, and they've not been given any form of inducement, and majority of them, their morale is actually high. Now, their morale is low. Why do we have few doctors in Taraba State? I talked about the fact that they're actually less than 90. In fact, we have to give credit to His Excellency, the Executive Governor of Taraba State, like it says, Darius Dixon Ishaku, since resumption as Governor of Taraba State. As before his coming into the state, we have less than 30 doctors within the state. But he had actually given express order for employment of doctors and even consultants within the state. But within the last 2 years, the ministry have actually employed nothing less than 50 to 60 doctors. But at the moment, as at this particular press briefing, majority of those particular doctors that were employed have actually left the state. Some of them have migrated to Federal Medical Center, while some of them have actually migrated to states like Yobe, Adamawa, and Gombe. And the last employment that was actually, it was advertised everywhere, and I believe the press have actually seen it. There was actually an interview for doctors. Just only less than 10 doctors, both consultant and medical officers, turned out for this particular interview session. And out of these people, the ones that were offered employment, they were actually supposed to pick up their employment letter for them to start working with the state immediately. Out of all of them, nobody has picked employment letter. Some of the people that were given employment have actually gone to neighboring states for them to pick up jobs there. And why is it so? The major reason is because the state has not yet implemented what is called skipping, that is the salary scale for doctors. So you actually find out that doctors in Taraba State are earning way below what is obtainable at the neighboring Federal Medical Center, or even our neighboring states like Yobe and Gombe. And because of this, majority of the people that are actually being employed, they don't stay. And it is also worthy of note at this particular point in time that currently within the states, we have, out of this less than 90, we have majority of the doctors working within the state are of the younger age group. It means that majority of them have high tendency of migrating. The reason why we're actually doing this, or maybe we've actually been prevailing on government to actually look into this issue, is because I'm sure in less than 5 years, we're likely not going to have sufficient numbers of doctors within the states that will actually cater for the health needs of the state. And we also know that Taraba State populace are actually poor. They are not very well to do, and some of them can actually afford the health care that is being done within the state. So because of now, sometime when we first of all went on strike, that was in September, based on the following issues. For instance, the issue of provision of grossly inadequate personal protective equipment for all healthcare workers in the state. Because at the moment, we are actually working without personal protective equipment like face masks, apron, and so on, face shield, and so on and so forth. So a lot of us have actually been exposed to this virus. I, for one, have actually had to self-isolate, and even our financial secretary, even the secretary also had to go on self-isolation, and some of the other members. And within the state so far, we actually had about more than 25 healthcare workers that were exposed to this COVID-19, and about 5 doctors that were also exposed. So what we are demanding for is for the implementation of the MOU that was signed with government on the 28th of September. This is 3 months since that particular MOU was signed, and so far it is just only one item on it that have actually been implemented. And why is this? So one of the items on the MOU that was actually signed was actually just for the fine. We've actually done we've done a lot of advocacy visits. We've written letters. You could actually see here. These are actually copies of various letters that we've actually tried to reach out to His Excellency, and even majority of the people in authority for these particular issues to be solved amicably. But none of that have actually yielded the desired result, and hence we actually had to more or less resort to this to the current strike that the association is on. We are indigents of Taraba State, so it's not like we're actually coming from anywhere. We love our state. We also believe in our state, and we want our people to and we want our people to actually get the best form of healthcare. But at the same time, we can actually do that at our own risks, because you have to be alive for you to be able to provide any level of care. So we're actually appealing to the general public, stakeholders within the states, political leaders, people who are actually well-to-do within the states, in the spirit of Christmas, season of love, for them to prevail on the government to actually look into these particular issues. We're actually ready for negotiation, and we believe in the capacity of His Excellency, the Executive Governor of Taraba State. He has done so well, and he's still doing well for the health sector. But we also believe that if he can do some of these particular, if he can take care of some of these particular issues that we've actually raised, especially by implementing the MOU that was signed with the association, we believe that he's going to leave a legacy in the health sector that in years to come it will even outlive him. And while in rounding up, you could after you talk about the issue of insecurity, we've had a couple of our medical doctors that were actually kidnapped, and some were actually killed. So doctors are also not left out of the issue of insecurity. So we're actually pleading with the authorities to look into these issues that we've actually raised, for us to be able to have a lasting solution, so that we can salvage the health sector of Taraba State, that our people and our families, our friends within the rural settings can actually access level of care. Thank you very much.